And now I'm joined by two doctors to advise us on what to do to keep from getting sick as we are seeing the coronavirus continue to spread around the United States and the world. Dr. Jennifer Ashton is ABC News' chief medical correspondent, and Dr. Nahid Badalia is an infectious disease physician at Boston University School of Medicine. Dr. Nahid Badalia, I want to start with you. First of all, thank you for joining us tonight. What should people be doing right now to keep themselves and their families healthy? I mean, it seems obvious to wash your hands and sanitize surfaces, but what do you really want people to know?
Yeah, I think the most important piece of news for me this week was Dr. Tony Fauci from NIH saying earlier that we are going to see more cases because we've increased our ability to test for them. Most states have the ability or are on their way to getting that. But we also broadened the way that we test for this disease, which means even if there were cases before, we're going to detect them now. And so it's not so much that they occurred over the last week, but to expect that we will see this. And I think it's important to stress that because I think when you hear about new cases, people are getting into this phase of panic, which I think is not as helpful because we know what this disease is and we know how it's transmitted. And in fact, as you mentioned from the type of interventions that you just said, the way that we protect from this disease is very similar to how we protect ourselves from other infectious diseases in our community, like norovirus or influenza. It's ensuring not only that we wash our hands, but we do it in a thorough and mindful manner. Not only that we decontaminate, but we look for places, where there might be a lot of, frequency of people touching and ensuring that we disinfect that, keeping our distance from people who might be sick, but also staying home if we ourselves are sick. I mean, that's a good place to start, I think, in terms of interventions.
But Dr. Jen, who should get tested? Where do you get the testing kits from? If I've just returned from an infected country and I'm having flu-like symptoms, what should I do?
Well, just last week, we saw, largely in response to that first community case, person-to-person spread in the community in Washington state, the CDC revised their testing guidelines. Now really includes 3 categories of people. 2 of those categories, and this is really important, Lindsay, apply to hospitalized patients. So while we're seeing a lot of concern in the community, certainly understandably, because a lot of people have been traveling recently in the last couple of weeks and months, and if they develop a symptom that much more likely could be something like influenza or RSV that we see commonly, right now the testing criteria just revised by the CDC have 3 groups. One of them is a critically ill patient, so this would be someone in an ICU setting with severe respiratory disease and no other explanation. So that means every other infectious etiology or source has been ruled out. Doctors are completely mystified. That person is a candidate for testing. The other category is a patient who has recently traveled to one of the 5 affected countries, and right now it's just 5 countries in the last 2 weeks, and has fever and or symptoms of lower respiratory disease, so cough, pneumonia-like symptoms, hospitalized. And then the third category is someone who has known contact with someone who's had coronavirus in the last 2 weeks and has either a fever or signs or symptoms of pneumonia, so things like a cough. If you're not in that category, meaning if you're home, you just develop a sore throat, even if you've just gotten off a plane from Italy, you are not meeting criteria for CDC testing, and that's important for people to know.
And Nahid, we've seen obviously more cases in the U.S. this week, but you say that that's because more people are getting tested. So is that actually a good sign that we're improving our diagnosis methods?
Yes, I think it is. I think it's going to serve both in terms of detecting any new cases, but really giving us a better sense of how many cases, if there are a small number of cases, that's great. Then we know where to invest our energy. The one other thing that I wanted to say is that as the number increases, whether it's small or large, I think that people will want more information. And as you've already seen, there's this thirst for more information, and I cannot stress enough the importance of going to dependable sources like the CDC website or the World Health Organization website. But what I've really seen that it's great is that many states have actually now instituted hotlines where people can call, particularly those that have seen cases, which I think will allay a lot of fears and guide people to the right resources.
When this first was an epidemic and problematic in China, we saw immediately President Trump stop flights coming in and out. And people started getting tested. But Italy now, they have more than 1,000 cases. You can still travel in and out. It doesn't sound like everybody's getting tested. And then you have the issue of Washington State. At what point do you stop flights coming in and out of Seattle? I mean, what?
So the travel confusion has been logistically challenging. I mean, we live in a global society, no question. When you look at the 4 steps of controlling an infectious disease outbreak, the first is identify your pathogen. So this is potentially what we call a high-impact respiratory pathogen because it's highly transmissible, but looks to be low risk of death, which is good news, and we expect that number to even go down further as we get a better grasp on how many people are truly infected. Then the next step, Lindsay, in controlling an outbreak is to isolate it. That's the containment phase. So if you have flights coming from known other countries of affected areas, hotspots, if you will, South Korea, Italy, bringing hundreds and thousands of people into the United States every day for the last 1 to 2 months, it's to be expected that there are people who may have no symptoms at all or very, very mild symptoms, so mild, in fact, that they might not even seek medical attention, circulating around every part of this country. And that's not meant to scare people. That's a reality. And I actually think from a medical standpoint, it should be reassuring because that means, you know, maybe it's already been so common and prevalent in our society for the last 1 to 2 months, and more people have not gotten very sick.
And one more question from you before we go. A personal question that I'm hoping that other parents may have as well. My son has a little bit of a hoarse throat, and so he said, do I have coronavirus? Am I going to die? How do parents talk to their children about coronavirus? I
think the first thing is on an age-appropriate basis, find out what they know, because that will be different depending on their age. And children, especially grade school children, their primary interest is being reassured as to their safety. So, you know, to say as a mom, even though my kids are in college now, you know, I've spoken to them about this and say this is a virus and, you know, what steps are being taken in our country and our local communities, what steps can be taken of you by your pediatrician if you get sick. And I think that segues and brings up a really important aspect of this story, Lindsay, which is the psychological or emotional element here. This can be a stressful and anxiety-producing situation for people when they're bombarded by coverage and press conferences and headlines. And I think that what's really important when politicians or, you know, elected officials have to communicate sensitive medical information like this that they might not be that familiar with or used to doing, sometimes when you say to someone, don't panic, that can be interpreted as being dismissive or even insulting and actually causing them to panic more, even though that's not the intention. So I think both children and the public needs to hear the following. I know this is stressful. These are the steps that your government, public health officials, and the government in general are taking, and these are the steps that you can take to lower your risk and protect yourself. And that gives someone actionable, but also, you know, understanding and empathetic steps that they can take to deal with this, because, you know, in medicine we deal with this a lot, but the lay public does not.
All right. Our thanks to both of you, both doctors. We thank you for joining us tonight.